Hi, my name is Daryl Sellers, and today I'm going to be talking about quarantines and isolations. I'm going to be discussing who has the authority to initiate a quarantine or isolation situation, and if they protect civil liberties or not. Quarantine and isolations are both health practices that are used to stop or limit the spread of contagious diseases throughout the United States. They're both government issued, and they deal with the separation of people, but they're used in different ways. A quarantine is a state, period, or place of isolation in which people or animals that have arrived from elsewhere or have been exposed to infectious or contagious diseases are placed. And infection is when people or animals have been separated because they've already been affected by infectious or contagious disease. The Secretary of the Department of Health and Human Resources is responsible for preventing the spread of contagious diseases that's already within the United States. The Division of Global Migration and Quarantine, they're responsible for preventing the disease from coming into the United States. So like if a package or a person is coming to the United States, they make sure they're disease-free before they arrive. The federal government also helps to prevent the spread of contagious diseases from entering the United States and spreading within the United States. They're authorized to take any measures to help prevent the spread. And they're able to assist They're able to accept and assist state and local authority help in situations like this. In order for a quarantine or isolation situation to be carried out, there are checks that the government must consider. It needs to include the right to review and counsel. State must provide clear and convincing evidence. Evidence must be supported by scientific data, and it must be at least restricted. And this is to protect the person's civil liberties. In July 2006, doctors in Phoenix, Arizona diagnosed Robert Daniels with extreme multi-drug resistant tuberculosis. According to Protecting Liberties by Sarah Pope, he was sent to a medical center lockdown ward for treatment and to prevent him from spreading the disease to other people around him. At the ward, Robert Daniels was strip searched, prohibited from going outside, talking to his family, and prohibited from exercising. According to the Phoenix News Times, he was there for 10 months, and he went through this for 10 months. May 31st, 2007, the American Civil Liberties Union filed lawsuits against the county for Robert Daniels for the way he was treated at the ward. In cases like this, the state has authority to quarantine and isolate a person to protect the rest of the United States. But they have to take into account the person's civil liberties and human rights. Any restriction that they have during a quarantine isolation situation, it should be legal and minimally restricted. What the ward should have done, they should have gave him all of his rights, which includes him going outside, him exercising, and him even talking to his family. And they could have used a method called dot therapy, which is this right here. And that's when the doctor or a health professional keeps a close eye on the patient. And this is a little bit more about dot therapy. Like I said, it's when a healthcare worker watches the patient, make sure they're taking their medicine, and make sure making sure they keep themselves safe and the people around them. And in conclusion, quarantine and isolations are both health practices that are used to keep the U.S. safe. But we have to remember, when the government issues a quarantine or isolation situation, they have to take into account the person's civil liberties and human rights. Thank you. Oh wait, those are my sources. Thank you.
These are our audience.